Jones.
Diolch, Deputy. Thank you for your statement, Minister, and I welcome the delivery plan. And since the implementation of the smoking ban, it is good news that smoking in the home has reduced from 80% to 46%. Ash Wales says this suggests there is a better understanding of the dangers of second-hand smoke, especially around children and families. So therefore, although we look at this as a 34% decrease in smoking in the home, we must remember that the other people in the home who are benefiting from not being exposed to this second-hand smoke also. As mentioned, smoking is one of the main causes of inequalities in health, and smoking rates in poorer areas are more than double those in affluent areas. So I wonder how we are going to deal with this inequality aspect. And whilst visiting hospitals within my region, I was alarmed at the amount of people outside of the hospital, but in the public area, who are still smoking. So I am pleased that the statement acknowledges this and plans to include areas to extend the ban to such as these. It would seem all the information in the world will not help some people beat this addiction. And I'm not criticising, but trying to understand that when people become hooked on cigarettes, it must be awful if you cannot beat the addiction. So despite knowing the dangers of smoking and that in Wales it contributes to 5,450 deaths per annum, people are still smoking. So this is a concern, and we must do all that we can to combat this and help people more. My concern is the second-hand smoking surrounding babies and children. And I have watched programmes on television of how an unborn baby reacts to smoke, and this is very disturbing to watch, but I'd like to sort of see more of it advertised. And parents who smoke are highly likely to influence the children who live with them. So that's disturbing to read that 64% of secondary school pupils reported being exposed to second-hand smoke. So I wonder if you agree with me that this area does need consideration. And as 19% of Welsh adults are still smoking, what research and information has the Welsh Government undertaken to assist with reducing this number? Also, Ash has stated that in prisons the ban has been 100% successful. But I understand that since this ban, the number of self-harm incidents in prison have increased among prisoners, as has violence, and violence prisoner on prisoner and prisoner on staff. Is this due to the frustration and the improvisation of a cigarette from trying to smoke tea bags in order to improvise the non-access to a cigarette? So these people have mental health issues, and coupled with being locked up is adding stress. So I wonder if we could ask that some research is undertaken regarding the above statement, that Ash has 100% compliance to this, and if we can re-evaluate, if necessary, the success claims regarding these prisons. The banning of smoking anywhere near playgrounds and children's areas is a must, and I'm pleased to see that the plan is making provisions to stop this. I'm pleased the statement acknowledges the harm that second-hand smoking has caused and the plans to deal with it. And also, I'd like to ask about the collaboration with other services, such as cancer research and ASH and other areas. Thank you very much.